You've probably never asked your doctor this question, but maybe you've quietly wondered, is daily masturbation after 60 helping your body or hurting it? It's one of those private habits that men rarely talk about, not over dinner, not with friends, and often not even in the doctor's office. But as we age, our bodies change. Hormones shift. The prostate becomes more important than ever. And suddenly, the quiet questions start to surface. Am I doing something wrong? Is this affecting my prostate? Is it safe to keep going every day? If you're in your 60s or older, this question is more common than you might think. But the answers, they're buried under a pile of myths, clickbait headlines, and half-truths. Some say masturbation drains your energy, weakens your bladder, or raises your risk of cancer. Others say it's the secret to staying healthy and disease-free. So, what's the truth? In this video, we're cutting through the noise. No shame, no moral judgment, just science. We're going to break down the latest research, what it says about ejaculation frequency, prostate health, and what actually happens inside your body after 60. Whether you're single-partnered or somewhere in between, this might just change the way you think about your health and your habits. So grab a coffee, take a seat, and let's talk about what no one else is talking about, but probably should be. The prostate is a small walnut-sized gland located just below the bladder and in front of the rectum. It plays a crucial role in male reproductive health by producing seminal fluid, the nourishing and protective liquid that carries sperm during ejaculation. Although most men rarely think about their prostate when they're younger, it becomes more relevant with age. As men get older, the prostate naturally tends to grow a condition known as benign prostatic hyperplasia, or BPH. While this enlargement isn't cancerous, it can still cause a range of uncomfortable urinary symptoms. These may include a weak or interrupted urine stream, difficulty starting or stopping, urination, frequent urges to urinate, especially at night, and the feeling of not fully emptying the bladder. Beyond these everyday annoyances, there's a more serious concern: prostate cancer. Risk for this disease rises significantly after the age of 50. That's why understanding the prostate, how it functions, and how it changes over time is so important. By paying attention to early warning signs and making proactive health choices, men can better protect their prostate and overall well-being as they age. Whether you're experiencing symptoms now or simply want to stay informed, knowing how this small gland affects your body is essential. In recent years, scientific research has shed light on the potential relationship between ejaculation frequency and prostate health. One of the most notable studies comes from Harvard University, published in 2016, which followed over 31,000 men for nearly 2 decades. The results were striking. Men who reported ejaculating 21 or more times per month had a 33% lower risk of developing prostate cancer compared to those who ejaculated only 4 to 7 times per month. While this doesn't suggest a guaranteed method of prevention, it does point to a meaningful correlation between regular ejaculation and reduced cancer risk. One proposed explanation is known as the prostate stagnation hypothesis. The theory suggests that the prostate produces fluid continuously, and when that fluid remains stagnant for extended periods, it may accumulate cellular debris, inflammatory compounds, or potentially carcinogenic substances. Regular ejaculation may serve as a natural flushing mechanism, helping to clear out this buildup and maintain a healthier internal environment. In addition, ejaculation has been associated with reduced inflammation, improved cellular turnover, and decreased stress levels, all of which contribute to overall prostate health. While further research is ongoing, current evidence supports the idea that regular non-compulsive ejaculation may play a protective role in the aging male reproductive system. From a medical standpoint, daily masturbation is generally not harmful for most men, particularly those without a regular sexual partner. It can serve as a normal and healthy part of one's sexual routine, helping to reduce stress, support sexual function, and even improve sleep. However, it's important to distinguish between healthy frequency and compulsive behavior. When masturbation becomes compulsive, meaning it is done repeatedly without conscious intention or is used as an emotional coping mechanism, it can lead to several physical and psychological concerns. Over time, excessive stimulation without adequate recovery can result in fatigue-reduced sensitivity and even a phenomenon known as sexual desensitization, where more intense or prolonged stimulation is needed to achieve arousal or climax. This can interfere with both solo and partnered sexual experiences. Furthermore, frequent stimulation without rest may contribute to pelvic congestion, a condition marked by a sense of heaviness or discomfort in the lower abdomen or groin. In certain cases, particularly with poor posture or prolonged sitting repetitive motion, may also place stress on the pudendal nerve, potentially resulting in numbness or chronic pelvic pain. Thus, while regular ejaculation may support prostate health, moderation and body awareness remain essential for maintaining overall sexual well-being. When evaluating whether your masturbation habits are supporting or potentially undermining your overall health, particularly after the age of 60, it's important to approach the subject with honest self-reflection. As a physician, I encourage patients to pay attention not just to frequency, but to how the activity is affecting them both physically and emotionally. One of the first questions to consider is whether you feel energized or depleted afterward. In a healthy pattern, ejaculation should provide a sense of relaxation or even revitalization. However, if you find yourself feeling unusually fatigued, mentally foggy, or emotionally drained, it may indicate that your body is not recovering adequately, or that the behavior is being driven by compulsion rather than balance. Another essential aspect is mindfulness. Are you engaging in the act consciously with awareness of your body and emotional state, or has it become a routine behavior performed on autopilot? When an action is repeated without conscious intent, it can lose its psychological benefits and instead become a symptom of emotional avoidance or stress response. Lastly, take note of whether your stimulation threshold has changed. If you are needing more intense, prolonged, or specific forms of stimulation to achieve the same result, this may be a sign of desensitization, where the brain and body begin to respond less sensitively to familiar stimuli. This phenomenon is common in compulsive behavior patterns and may eventually interfere with partnered intimacy or even solo satisfaction. Recognizing these subtle changes allows you to adjust habits before they become problematic. The goal is not to label masturbation as harmful, but to foster a relationship with your body that is intentional, healthy, and adaptive to the natural changes that come with aging. Self-awareness remains a key component of long-term sexual and emotional well-being. As men age, it becomes increasingly important to recognize early warning signs that may indicate underlying prostate or urinary tract issues. While occasional symptoms may be harmless, persistent changes should not be ignored. One of the most common signs of a potential problem is frequent nighttime urination, known as nocturia. Waking up multiple times during the night to urinate may suggest that the prostate is enlarged and placing pressure on the bladder, reducing its capacity and signaling urgency even when it's not full. Another red flag is a weak or interrupted urine stream. If you notice that your urine flow has become slower dribbles or stops and starts midstream, it may indicate that the urethra, the tube that carries urine out of the body, is being compressed by an enlarged prostate. This can also lead to incomplete bladder emptying, where you still feel pressure or discomfort after urinating, increasing the risk of infections and irritation. Pain, burning, or discomfort during ejaculation is another symptom that should prompt medical attention. This could be caused by inflammation, infection, or chronic prostatitis, and may be linked to either excessive or insufficient ejaculation. Additionally, more generalized symptoms like persistent fatigue, low libido, or erectile dysfunction can be subtle indicators of hormonal imbalance or poor prostate health. These changes may reflect declining testosterone levels, impaired circulation, or emotional stress, all of which can affect sexual function. While none of these symptoms confirm a serious condition on their own, they serve as important signals that something may not be functioning optimally. Early evaluation by a healthcare provider can help differentiate between benign age-related changes and more serious conditions like prostate cancer or chronic inflammation. Timely diagnosis and intervention often lead to better outcomes and a higher quality of life. Maintaining a healthy prostate requires more than focusing solely on ejaculation frequency. While regular ejaculation may offer certain benefits, such as reducing inflammation and promoting fluid clearance, it is only one component of a much broader picture. Prostate health is intricately connected to overall physical well-being, and key lifestyle factors play a significant role in supporting long-term function. Diet is particularly influential. Consuming foods rich in antioxidants such as tomatoes, cruciferous vegetables, and omega-3 fatty acids has been associated with a lower risk of prostate disease. These nutrients help reduce oxidative stress and support hormonal balance, both of which are crucial as men age. Regular physical activity is also essential, not only for maintaining a healthy weight, but also for promoting circulation, regulating testosterone levels, and reducing systemic inflammation. Stress management and adequate sleep are equally important, as chronic stress elevates cortisol levels, which can interfere with hormone function and immune regulation. Sleep deprivation has been shown to impair cellular repair and increase inflammation, further burdening the prostate and other organs. In short, ejaculation may play a supporting role, but without proper attention to nutrition, exercise, mental health, and rest, its benefits will be limited. A holistic approach remains the most effective way to preserve prostate health over time. Protecting prostate health as men age requires a proactive and well-rounded approach. While some factors such as genetics cannot be changed, many modifiable lifestyle choices can have a significant impact on reducing the risk of prostate-related issues, including benign prostatic hyperplasia, BPH, chronic inflammation, and even prostate cancer. A four-part strategy that addresses nutrition, physical activity, stress management, and medical monitoring can provide a strong foundation for long-term prostate wellness. First, dietary choices are crucial. Consuming foods rich in specific nutrients has been shown to support prostate function and reduce inflammation. Lycopene, a powerful antioxidant found in tomatoes, watermelon, and pink grapefruit, may help lower prostate cancer risk. Cruciferous vegetables like broccoli, cauliflower, and Brussels sprouts assist in detoxifying excess hormones and supporting cellular health. Omega-3 fatty acids commonly found in fatty fish, such as salmon, and in walnuts or flax seeds, reduce systemic inflammation. Zinc, found abundantly in pumpkin seeds, supports healthy testosterone levels and normal prostate tissue maintenance. At the same time, limiting processed meats, high-fat dairy, and excessive sugar can reduce inflammatory burden. Second, regular physical activity is essential. Engaging in at least 30 minutes of moderate exercise most days of the week, such as brisk walking, swimming, or light resistance training, improves circulation, regulates body weight, and helps balance hormone levels. Obesity and sedentary habits have both been linked to increased prostate disease risk. Third, managing chronic stress is often overlooked, but deeply important. Elevated stress hormones like cortisol can impair immune function, promote inflammation, and negatively impact testosterone balance. Incorporating daily stress-reducing practices such as deep breathing exercises, spending time in nature, cultivating close social connections, and even activities like yoga or meditation can lower inflammatory markers and improve overall well-being. Finally, routine medical screening is critical, especially for men over the age of 50 or those with a family history of prostate conditions. A simple blood test called PSA prostate-specific antigen can help detect early changes in prostate function. When caught early, most prostate issues are highly manageable. Regular checkups ensure timely intervention and peace of mind. By combining these 4 pillars, diet, exercise, stress management, and medical oversight, men can take an active role in preserving prostate health and maintaining quality of life well into older age. In conclusion, daily ejaculation is not inherently harmful. In fact, when practiced with awareness and balance, it can offer real benefits for prostate health, hormone regulation, and overall well-being. But it should never be viewed as a standalone solution. True lasting health comes from a holistic approach, nourishing your body with the right food, staying physically active, managing stress effectively, and keeping up with regular medical checkups. These combined efforts support not only your prostate, but your vitality, energy, and quality of life as you age. If you found this video helpful, informative, or even eye-opening, we invite you to be part of our growing community. Subscribe to Ageless Mind and Body for more science-backed insights on men's health, longevity, and living fully at every age. Don't forget to hit the like button and turn on notifications so you never miss an update. And in the comments below, let us know what topics you'd like us to cover next, because your health deserves real answers, not silence.